My name is Rasmus. I'm from Dreamtown. Dreamtown is a Danish NGO that works across Africa on public spaces. The way that we work on public spaces is that we see it as a youth empowerment process. So the work that we do produce public spaces, but the reason that we do these public spaces is to work with youth around taking ownership and develop their skills in project management, participation, advocacy in the process of actually developing these public spaces. Today, I would love to share with you a presentation on our work on public spaces, which takes place across urban Africa. I have called this, this presentation the Nexus Space, and I will come back to the reason why I'm calling it the Nexus Space at the end of the presentation. But what this presentation is really about is the power of public space in urban slums during the COVID-19 pandemic. For the next few minutes, I will talk about COVID-19 challenges in urban slums, a case on Sierra Leone where we're working on safe spaces, a case from Uganda where we work on green spaces, and finally wrap up with some lessons learned and perspective on future research. So as Greg also touched about, there's this wonderful report or response plan from UN Habitat that really shows 95% of all the cases are in urban areas, and where we work in urban Africa, we see that 60% of the population live in informal settlements. This data is substantiated by looking at the latest SIDREP from Sierra Leone of the cases of corona. As you can see, by far, most of the cases are detected in the capital Freetown, Western area urban. As we can also see, there's no detection of death, but what we also know is that there's a big shadow field around these numbers. So we suspect that the cases might be even higher. So when we talk to the people around these slum communities about what do they see as the core challenges that we need to address, we see different ones. One is, of course, this: how do we create awareness on the COVID-19? And we see a lot of NGOs doing programs on awareness raising. But for instance, from Sierra Leone, what we also know is that their understanding of the crisis and how to protect themselves is actually very big. I mean, they went through the Ebola epidemic, and I think that it's fair to say that they are probably the global experts on how to protect yourself during a crisis like this. Of course, what the real challenge is that you don't have access to the infrastructure and the resources that enables you to protect yourself. So you don't have access to sanitation, and you don't have access to health, which is like one of the direct challenges related to the crisis. And then it's also a question about how do we support people's livelihood in situations of lockdown and distorted markets. It's very difficult for people to meet their basic needs just to get food on the table. You can't stay in your home when you need to go out and work. So how can we protect people's livelihood? And then, as we also saw during the Ebola crisis, how do we combat gender-based violence in teenage pregnancies? During the Ebola, we saw that the level of teenage pregnancies and violence just skyrocketed during the crisis, which was also due to the fact that the schools were closed and the students and the children were at home, where there was no people to really look over them and protect them. So we have the direct effects, which relates to health, and then we have the indirect effects, which relate to livelihood and gender-based violence. So my proposition here is that public spaces can be an important part of the solutions to many of these problems. And I will talk a little bit about why that is now. So here's the first case. Here we are in Freetown. So for the last year or 2 years, together with Urban Synergies Group, we developed public spaces, youth centers, creative hubs, hangout spots across Sierra Leone. I think we developed more than 20 public spaces. When we developed these spaces, the intention was to create a cool, creative, inclusive environment for young people. What we see now during the COVID-19 is that these spaces are a really important resource for us, because now we actually have access into these communities. We have a gathering point where young girls can come and meet us, where they can get non-formal education, where they can report if a crime takes place, where we can actually install water, where we can distribute sanitizers. And if we hadn't gone through this lengthy process of negotiating land and finding the space and working with community informal and formal power structures, then we wouldn't have this access to actually distribute these like very important basic supplies, and also to initiate a monitoring mechanism in terms of violence. So this is a case in which we see how a public space can actually be transformed into a function that takes care of a number of the challenges that we see during COVID-19, even though it was not initially designed to do that. So this is another case. Now we are in Kampala, in Uganda, where we for the last year have worked on developing parks, green spaces, urban gardens, together with local youth groups. So when we just started this project, I mean, the idea was to create very much along the livability paradigm, like a nice and vibrant atmosphere in the slum, a cool environment. What we see now during the COVID-19 is that these small gardens, as the one you see in the picture, is actually providing people with a source of livelihood. This can actually cater for their basic needs when it's too expensive to go to the market to get food, or if you can't go out of your house to get food. We have also seen how we can transform, if you can see in the pictures, this is like actually a larger space we're working on to make like into a green park, that we're using these spaces strategically to install, this is a tippy tap, so it's like a local innovation on how you can wash your hands, and where you can create awareness about how to stay safe. And now my alarm went, so I'm already on 7 minutes. So lessons learned and future research. So what we see is that spatial access is vital in an emergency. If it wasn't because we had these public spaces, it would be difficult for us to intervene. Another key lesson is that the spaces that we work on, they need to have like a multi-purpose, and they need to be adaptable public spaces, so that you can't put too many fixed functions into them. They need to be able to adapt together with the people, together with the context, together with the evolving situation. And finally, is the term that we're working on now. How can we think about public spaces as a nexus space? So in the development world where we come from, we talk about the nexus between development work and humanitarian work. So what we're really looking into now is to see how a public space both can have a function in times of development, but it also can have a function in times of a humanitarian crisis. So I think maybe I just want to rephrase it. So we are talking about a year without public space, but for us it's actually really a year with public spaces where we see the power of space. Thank you so much.